Well, good morning, everybody. I'm Scott Wester. I have the privilege of being the president and CEO of Our Lady of the Lake. And welcome to this beautiful campus here in North Baton Rouge. And Governor, always thank you for all your support and the commitment you've made, especially within our emergency room that's been open for the past couple of years. Heard a story earlier today about how someone from downtown had an ankle injury and decided to come over here and said it was the best ER experience they've ever had and the quickest ER experience they ever had. So sometimes people forget it might be a little bit nicer to be in a location such as this rather than maybe on Essen Lane. Today here we're talking about how important it is for our flu vaccine, and it's this time of year that we get our annual vaccination. Dr. O'Neill, who's our Chief Medical Officer, tells us always it's all about herd immunity. It's about making sure that us as caregivers, that we set the example throughout the community in ensuring that all of our team members across Our Lady of the Lake gets a flu vaccine. It's very vital for the care we provide to our patients and also for the families that we come in contact each and every day. It's a pleasure for us to welcome the governor here today, as well as Dr. Phillips, our Secretary of Louisiana Department of Health, and the rest of the team from the governor's office. I'm going to now turn it over to the governor, and then we're going to have Dr. Clark kind of talk a little bit more about the vaccine. Governor.
So thank you, Scott. It's great to be back over here this morning, and I will tell you, I appreciate all the work that you and your team do over here. Dr. Clark, thank you for being with us this morning. And of course, we have Secretary Marquita Walters from Children and Family Services here, and also Dr. Phillips from the Department of Health. We're over here this morning to get our flu shots. And the reason is it's never been more important than this year for people to get their flu shots. And we're not trying to confuse the two things. The flu vaccine doesn't prevent COVID-19. But what we know is patients who need to be hospitalized with the flu are going to be taking up capacity and resources that we need to have available for people with COVID. And so it's never been more important than this year, while we have a raging public health emergency around the COVID-19 pandemic, for people to get their flu shots. It's easy, it's low cost, they're available just about everywhere that you can imagine. So we're encouraging people to do that, and make sure you do it soon, and bring all the members of your family to make sure that they get their shots as well. And the good news is that all the mitigation measures that we're taking against COVID-19 work against the transmission of the flu as well. So whether it's this mask, whether it's physical distancing, washing your hands, staying home when you're sick, all of these things help to reduce the transmission of the flu. Incredibly important. So we're encouraging people to continue to do that as well. So the campaign is Roll Up Your Sleeves, Louisiana. I decided to do one better. I wore short sleeves today so that I could easily get my shot. But I do commend this to everybody out there. It is more important than ever. I believe the flu vaccine can be safely administered to children as young as 6 months. And so literally from 6 months old all the way up, we need people to get their flu shot this year. So thank you all for coming out for this. I think Dr. Clark is going to follow me with some information about the flu vaccine, and then we're going to go over and get vaccinated. I do want to, Scott mentioned herd immunity, and he's talking about through vaccination. That's how you get herd immunity. And that's true as it relates to the flu. That's also true as it relates to COVID. We don't have vaccines for COVID yet, but we are not interested in achieving herd immunity with COVID because of people just catching the virus and contracting the disease. Because we know already with our experience, less than 10% of Louisianans have contracted the virus, and we're at 5,500 deaths. So if you just do the math, because herd immunity requires 70 or 80% of the people to get it, and just extrapolate out there and see how many hospitalizations, how many deaths. We're not interested in that. But when that vaccine comes out too, we want people to make sure that they understand it is safe, it's going to be effective, and we want them to get vaccinated as well. Dr. Clark?
Okay, I'm Dr. Joshua Clark. I'm a primary physician in Primary Care 2 here in the North Baton Rouge Clinic. I just want all patients out there to realize it's very important to get an annual flu vaccination, easily administered, well tolerated. It has to be given once a year because the flu virus is a different type of virus. It replicates and mutates very actively, so we have to stay ahead of the virus by formulating new vaccines that are administered once a year. A lot of patients tend to say things like, well, I never get sick, so, maybe I shouldn't get the vaccine. Well, it's good if you've never contracted the flu virus, but keep in mind, and even if you don't get very ill from the flu, others around you, people that you live with, from your grandmothers, elderly folks, to the very young, can be very seriously impacted from this illness. And vaccine is the #1 preventative measure we have for treating the flu. So just keep that in mind. A lot of the symptoms overlap from flu to COVID. So it's very important that if you're not vaccinated against the flu virus, it's hard for us to tell whether is this influenza or is this coronavirus showing up. But if you are vaccinated, at least we can know that it's probably less likely the flu. In either case, you should consult your physician and seek medical attention if you do have symptoms. Okay?
All right, so Scott, we just ready to get started?
Ready? Take a seat.
I'll be first.